I think the biggest motivation for any school nurse, including myself, is the saying that healthy students learn better, and school nurses help make that happen. What a strange couple of years it's been, right, for us with COVID. A lot of people think, oh, it's been around for 2 years, but this is really our third school year that we've been impacted. Even before COVID, our nurses had very busy schedules to get everything done that they are required to do, to be able to participate in care coordination for all of our students. So adding a huge component of COVID case management and disease surveillance and treating symptomatic kids, that was a lot to add to an already full plate. And I think what has kept our nurses going is being able to talk to each other, being able to relate to each other. It's really a challenging job as a nurse in a school because you're the only person on your campus that does that job, right? Teachers can lean over and lean on their other teachers and say, how about this? What is this? Can you just give me a break for a second? Right? And we've seen teachers doing that a lot in the last couple of years. But our nurses tend to feel a little bit insular, right? They're the only person on campus. We do a lot of fun having at our meetings, right, for team building stuff. In fact, just before spring break, we did a ropes course as a group, and we were able to relate so much of what we did, so many of the activities related to what the last couple of years have looked like, and burning out as an individual, burning out collectively, and it was really refreshing and reassuring to be able to see how we still work as a team even though we are one person on the campus. There is definitely no such thing as a typical work day for a school nurse. You have things that are definitely scheduled and you have things that are required to do throughout the year, but then you don't know what's walking through the door at any given moment. Right, so people think of the school nurse as where you go to get Band-Aids and peppermints and ice packs, but also a lot of daily medication, emergency preparedness, like I said, training staff, also care coordination for a lot of our kids who have medical conditions. Also, we do a lot of state-required screenings and vision and hearing screenings. I can't tell you the number of times that we've had somebody who may be a behavior problem in class or is not paying attention or is distracted, and they send them to the nurse and they do a vision screening and figure out that the kid can't see the board. So of course he's not paying attention, he doesn't know what's going on. And that makes a big difference. Our hearing screenings, we've had a kid already scheduled for surgery this year because of what we found on the hearing screening. So we look at a lot of things for the whole child, and really and truly, how does that apply to them in the school setting? What are we doing? Can they see the board? Can they hear the teacher? We do other health screenings as mandated by the state because a lot of kids across the state don't have a primary care provider. So they don't get those age-appropriate screenings for things that could be easily prevented or easily treated, like scoliosis, type 2 diabetes, high cholesterol. All of those things the school nurse looks for every year. Our nurses, even in a non-COVID year, do a lot of disease surveillance. So you have a kid who comes to the nurse, sore throat, goes home, diagnosed with strep. You have 2 more kids in the next school day, and guess what? They're all in the same classroom. So our nurses connect those dots and are able to communicate with families, hey, here's what's going around in your classroom. If your kid has these symptoms, you really should probably try to maybe keep them home and see if they're going to get worse or better, and get to the doctor if you need to. So that's not something that's new with COVID. That's something that our nurses specialize in. And we're very fortunate to have a full-time registered nurse on every campus. There are school districts that don't even have a nurse. 1/10 of the counties in Texas don't have a school nurse employed anywhere within their county. Which means that those kids are going to the school secretary when they don't feel good. The school secretary is picking up the phone, calling and going home, but the disease surveillance part isn't happening. And so they're not able to do the preventive measures that a school nurse would be able to provide.